my name is Dr. Layla Doolittle. I'm just going to give you a very brief summary of one of the treatment techniques that I use for pain in the body. So the PMRF, pontomedullary reticular formation, that can have integration and neurological signals that basically helps to increase the nociception or the pain signals. And what we want to do is we want to make this part of the brain to regulate those pain signals. So this part is capable of down-regulating improper nociception. So what we do is for any abnormal pain in the body, we're going to activate the cortex because that positively feeds a feedback loop into the PMRF, the vestibular system, which feeds into the PMRF, and the cerebellum also feeds into the PMRF. Now all of this will downregulate the IML, which is sympathetics. That's something that we don't want. That's that's the fight and flight. And we want to send people that have pain into more of the rest and digest because that's where the pain is able to decrease and relax. It's calming for the body. So what we want to do is we want this IML to be downregulated and PMRF to be upregulated. Some of the very simple exercises that I'll do for patients, I'll have them stand on a pad just like this. And on this pad, she's balancing, her feet are together, and basically what that's doing is that's going to help to make this vestibular system work a little bit harder because the cerebellum itself is what sends the proprioception in from the feet and the ankles, and whenever that goes in, then that basically is going to send a signal up to the brain to be able to have better balance. Now what I can do is I can also close her eyes, and then whenever she has her eyes closed, then it's all about vestibular system and cerebellum. But instead of her closing her eyes, I'm actually going to use this to activate the cortex at the same time that she's standing here on the pad, because the cerebellum is working from the proprioception in the feet from standing on the pad. The vestibular system is working because we're having her move her eyes in certain ways, and the vestibular system is having to help keep that balance throughout. And the occipital lobe, that's what has to do with eyes. So the occipital lobe, we want to use that for the parietal, the frontal, and temporal connections to all send that signal from the cortex. So that's going to regulate that PMRF to help decrease pain. So this is an example of how I'll work on the parietal lobe. Parietal lobe takes care of pursuits in the body. So this is what I do for the parietal lobe. It's very simple. Pursuit function back and forth in the horizontal plane. Horizontal eye movements are very calming to the brain. More calming than vertical, so I'll actually just do horizontal on this patient. Going horizontal plane only, and then we can go into convergences. That's working on the medial recti of the eyes, coming in towards the center. And I usually will just do 3 passes, and then I'll give the patient a little break. So then she's going to take about a 20 to 30 second break and just breathe to help that brain regenerate all those neurotransmitters and all the other neural connections that are in the body and the brain, and just helping to balance everything out. That's for the parietal lobe, which is up here. Frontal lobe down here. I'll use saccade function, and what I'll do is I'll bring these rock beads to right here at the center of her eyes. Horizontal plane again. We're going to go to green, blue, green, yellow, orange, pink, orange, yellow, green, blue, green, yellow, orange, pink, orange, yellow. So that was 2 passes with that. While she's taking a break, I'll explain that a little bit. Saccades, that's what's controlled by the frontal lobe. Frontal lobe controls the saccade, which is one movement from one position to the next. So it's from blue to green over to yellow. So it's each one of those dots. That's basically a movement from one spot to the next. That's a saccade. Now what I would normally do too is to activate the temporal lobe. I would turn on some music in the background that has a beat or consistent beat with it, or I would actually do a metronome. That's one of the easy ways. I tie that metronome with the saccade so that every time that there's a click, then basically she moves her eyes in the horizontal plane. You can go either direction. Every time that I click, you're going to move your eyes. So that's working with the temporal lobe, because that's what takes care of beat rhythm. That's what's hearing things in certain ways. And that temporal lobe, we're moving her eyes at the same time as the frontal lobe. That's working that. The occipital lobe, of course, is working with everything, because that's any movements that's with the eyes. Now I do want to use Optokinetics, which is basically fast saccades that are controlled by a reflexogenic movement. And the Optokinetics are located in the brainstem, basically the area that controls them, and that frontal lobe also helps with that mechanism. And so what I'm going to do is do her Optokinetics in the horizontal plane, and you see how her eyes are moving. You can kind of zoom in on her eyes if you like, just show how they're moving bouncing back and forth. See, as she's going into the optokinetics. And you can also see how it's inducing a sway in her. Okay, so that's part of it. Okay, now we're going to go ahead and step off of the pad, and I'm going to show you another part of the treatment where I actually will have you walk in a tandem gait walk. So you'll start over here by the desk, and you're just going to walk with one heel right in front of the other, just like this. Yep, perfect. And at the same time, we're going to do optokinetics to kind of throw her off balance a little bit and help that cerebellum work a little bit harder. Okay, we'll go ahead and go backwards now. Good. And you should tighten your core, and that helps to keep that balance a little bit. And then we're going to come forward one more time. Okay, go ahead and stop. That's just a little summary of one of the treatments that I'll use for helping to upregulate the PMRF. And that helps with pain signals. Thank you so much.